Good afternoon and welcome to the COVID-19 update on Channels Television, a 30-minute update on the coronavirus pandemic in Nigeria and across the world. I'm Millicent Walker. First, some of the highlights. Today, no respite yet as COVID-19 figures maintain steady rise in Nigeria. Community transmission, a source of worry to all as the president gives direct order on immediate lockdown in Kano State. And Botswana extends nationwide lockdown for 1 week to end April the 30th. And when the health minister, Dr. Osage Hanire, warned about the dangers of community transmission, not many knew the impact would be felt in such a manner. But with the situation in Kano, it's obvious something needs to be done to check local transmission and across the state too. Later on the program, our guests will take a look at community spreading, putting a check on the spread of infections and rising deaths. The huge task confronting the nation is how to bring under control the rising infection of COVID-19 with the challenge of test kits not helping matters. The Nigeria Center for Disease Control is on a daily basis reeling out new cases across the country. As it stands now, the total confirmed cases of COVID-19 has risen to 1,337, following the announcement of 64 new cases last night. The death toll remains at 40, while 255 persons have been discharged. While Lagos remains the epicenter of the pandemic with 764 cases, a breakdown of other states show the Federal Capital Territory with 157 cases, Kano 77 cases, Borno is next with 41, Gombe 37, Ogun has 35 cases, Osun 34, Katsina has 30, Edo has 25, Oyo 21, Kaduna 15, Kwara 11, Akwa Ibom 12, Sokoto 10, Ekiti 8, Ondo has 8 as well, so does Taraba, while Delta Rivers have 6 cases each, Abia 2, Enugu 2 as well, so also Niger, Jigawa, Zamfara 2 cases each, Benue, Anambra, Adamawa Plateau, Imo, Bayelsa, Ebonyi and Kebbi have 1 cases each. Nigeria's President Muhammadu Buhari, in his broadcast yesterday, appealed to all to cooperate with the Health Ministry, the Nigeria Center for Disease Control, and other agencies in the fight against COVID-19. While announcing an immediate lockdown in Kano State for 2 weeks, he extended the restriction of movement in Lagos, Ogun, and the FCT by 1 week, and a guide to easing lockdown order in those states from the first week of May.
For the past 4 weeks, most parts of our country have been under either federal government or state government lockdowns. As I mentioned earlier, these steps were necessary and overall have contributed to slowing down the spread of COVID-19 in our country. However, such lockdowns have also come at a very heavy economic cost. Many of our citizens have lost their means of livelihood. Many businesses have shut down. No country can afford the full impact of a sustained lockdown while awaiting the development of vaccines. We assessed how our factories, markets, traders, and transporters can continue to function while at the same time adhering to NCDC guidelines on hygiene and social distancing. We assessed how our children can continue to learn without compromising their health. We reviewed how our farmers can safely plant and harvest in this rainy season to ensure our food security is not compromised. Furthermore, we also discussed how to safely transport food items from rural production areas to industrial processing zones and ultimately to the key consumption centers. For the avoidance of doubt, the lockdown in FCT, Lagos, and Ogun states shall remain in place until these new ones come into effect on Monday, 4th May 2020.
President Muhammadu Buhari. Well, joining us for more on the strategies to flattening the curve and the rising figures is Professor Titus Ibekwe. He's an ENT surgeon, also a health educator. We'd like to welcome you to the program. Thank you for joining us.
Thank you, Millicent. I am very happy to be here.
All right. Professor, how would you say Nigeria is doing so far? Do you think that a week's extension in the two states and the Federal Capital Territory, do you think it will make a difference?
Millicent, this is a very unfortunate situation. It's in fact a precarious situation, so to say, is standing between the devil and the deep blue sea. So Nigeria is doing what she can in order to curtail this problem. But if you view it from every critical angle, you agree with me that it's not a one-step directional problem. It's dimensional, so to say, because apart from the health implications of COVID-19, the economic impact is another angle that is as important as that of the health. That's why it is simply described as disease of nature and nurture, and you must address those two angles. And now we have gotten to this critical stage of community transmission, which is what I can easily describe as going to the next level of distribution of this disease, which nobody really prays to get up to, because we realize that this is basically an imported disease. And if you're able to do an excellent case identification and containment of all those visitors who brought it in your own clime, and you're able to identify all the contacts and do appropriate quarantine and treatment measures, that is to say that you have won. But whereas some of these contacts slips off your net and off your radar, and they stays underground, and this is transmitted among individuals within their locality, within their places of work, within their neighborhood, unnotified and unidentified early enough, and this kept spreading, then you're talking of getting to the level of community transmission, which you can say that is really a very difficult situation, where much more effort had to be put in comparatively to what you would have invested if it had been curtailed to the level of initial transmission from imported cases. So we are here, and we have to put in every effort to ensure that the problem is solved. Lockdown on its own is just a means to achieving the end that we are moving towards. Lockdown cannot solve the problem on its own. Lockdown is a situation whereby you create this scenario to bring every situation to ground zero, so that the chances of individuals who are either carriers or who are actively infected mingling with the society and those people who are negative and readily infecting them, you want to curtail such situation by asking everybody to stay where you are. Whereas you deploy all the arsenals you have, ranging from, all your armamentum, the health, all your health implements, ranging from human and material resources. And that is why making sure that we have active centers in basically every state in the country is very imperative. Very functional, not just there, and ensuring that testing, we can't get tired of that, is going on. But you can see, even before the president's pronouncement yesterday, there were indications that the reagents and indeed the panels that are used for this test are really lacking, according to statement released by NCDC, which is a very difficult situation. If we stay like that, locked down endlessly, and we're not doing what we're supposed to do, we're not really making progress. And if you say lift lockdown and we do nothing, the disease will rise on exponential, level and basis, which is going to really be a very difficult situation. So we have to up our game. We have extended this by 1 week in Abuja, in Lagos, and in Ogun State. Yeah, but within this 1 week, that means that we have to do times 10 or even more than what we have done in the past. So we must mobilize all the resources and all the arsenals, carry on with the community testing as being done now, but with a lot, much more vigor in order to be able to identify all both active and, asymptomatic cases and remove them from the neighborhood and vicinities where they are staying to the isolation centers.
Professor,
where they will be assisted by doing all the necessary assistive therapy.
I must quickly ask you,
for them to,
as an ENT surgeon, based on symptoms, tell us about the role of hearing and tasting, because now we're hearing the CDC has added some more symptoms to COVID-19, such as chills, repeated shaking, muscle pain, and also sore throat. Apart from that, the new loss of taste or smell.
Thank you very much. Even in your channel here some time ago, over 1 week now, before this pronouncement was made, we raised this red flag that loss of taste and loss of smell apparently appear to be, early symptoms. In fact, you can regard them as red flags to COVID-19. It is known that between 33% up to 70% of individuals who have been infected with this disease, both actively infected individuals and those who are symptomatic, will first of all present with these two basic symptoms of loss of sense of smell and taste. And this may be the only symptoms that such individuals, especially the asymptomatic ones, will present with until their immune system is able to deal with the virus. So it is seen as a very early sign, in fact, a personal screening sign which each and every one of us should be awake to, so that if, as soon as any individual notices that he or she developed this loss of sense of smell or taste, it is imperative that you should self-isolate and call NCDC hotline to come and take samples so that you'll be able to protect your loved ones around you and also take good care of yourself. Over time, over like 6 weeks now, the ENT societies who have been raising this as a major issue, but of course we know that in the scientific world it takes time to investigate issues and give it the backing. So it took about that length of period for CDC on 22nd of this month to come out with pronouncement, yes, that this should be included as basic symptoms of COVID-19 disease. And 2 days later, our own NCDC followed suit. So it is a widely known thing that these two symptoms, and indeed the ones we have mentioned, are things to look out for. As we know, coronavirus has been with us for years now. However, this strain of coronavirus infection we are talking of is new, just basically 4 months old. And indeed, a lot of studies are still going on and information are still evolving. So little wonder then why this sense of smell and taste has been added, and indeed chills and rigors and other ones that you have mentioned, including sore throat.
Professor
So
Bekwe,
the new added to that means that within this period, any individual that developed this should take it serious. But if you have been having sense of loss of smell or taste before the discovery of COVID for any other reason, then that means that it's not likely to be associated with COVID-19. But any other case that arises within this period, until proven otherwise, is a basic mode of presentation of COVID-19.
We appreciate your time, Professor Titus Ibekwe, ENT surgeon, also a health educator. Thank you for joining us on the program.
I'm happy to be here. Thank you very much.
Still to come on our COVID-19 updates, more palliatives distributed across the country following restriction of movement directive. We have that story and more when we return. Well, Welcome back. With the third highest COVID-19 cases in the country and following a week of unexplained deaths in the state, the Presidential Task Force on COVID-19 is visiting Kano State today. Our correspondent Idris Jibrin report brings us this update and also takes a look at the compliance level following the directive from the President.
Well, thank you, Millicent. It is the first day after the President announced extend the total lockdown to Kano State. Already, Kano is in a total lockdown, and the President directives make it even more strict. Almost everywhere you pass in Kano State is locked. Only those people with essential services that are flying the road. And so many people have remained indoors, and a lot of things are going to happen. Like today, we are expecting the Presidential Task Force to visit Kano on a fact-finding mission. Now, I'm going to be talking with somebody who is also one of the people on essential services. Sir, can you tell us how is this total lockdown that is declared by the President going to affect the general activities in Kano State?
Actually, the lockdown in Kano have taken place since the announcement of Mr. President. And we have discovered that a lot of activities have shut down and everything is intact. Nobody is going out in order to control the COVID-19 spread. So the activities are paralyzed due to the lockdown. We must abide on it in order to avoid the spread of COVID-19.
Thank you very much. Well, Millicent, everywhere is deserted. People are indoor, and that is how it's going to continue in the next 2 weeks to come.
Many thanks, Idris Jibrin there, our correspondent in Kano. While in the nation's capital, Abuja, lawmakers in the Senate and House of Representatives have resumed plenary today, the 28th of April. Our correspondents report that some activities are ongoing. At the Senate, we hear a closed-door meeting is in session. The senators are sitting 2 seats between in compliance with the social distancing rules, 2 seats apart. And similarly, in the House of Representatives, our correspondent Terry Kumi in the House of Representatives reports that the Speaker, Mr. Femi Gbajabiamila, has asked the federal government to use federal lawmakers to distribute the palliatives. And the lawmakers in the Green Chambers are looking at passing a second economic stimulus, while asking the Senate to pass the first economic stimulus bill. We also hear that aides of lawmakers are expected to work from home and will be notified when needed in the offices. And the Lagos State Judiciary has issued practice directions to guide remote hearing court cases in the state. The remote hearings, which will begin on Monday, March the 4th, 2020, are to be done by Zoom, Skype, or any other video communication approved by the court. Notice of the remote hearings will be stated on the court's case list and the website of the judiciary. The same will be communicated to parties and their lawyers by email, WhatsApp, or other electronic means. According to the Lagos State Chief Justice, the practice directions were made pursuant to Section 6, subsection 6, section of the 274 of the 1999 Constitution as amended, Section 87, subsection 1 as well, of the High Court, Lagos 2015, and other enabling legislations. States across Nigeria continue to work out measures to curbing the spread of the COVID-19 pandemic and also ease the hardships following the lockdown. 15 different security agencies, including the police, the army, civil defense, and other sister security agencies, have benefited from the palliative aimed at mitigating the COVID-19 impact. The Ogun State government distributed stimulus food packages to men and women in the front line of duty, presenting food items and other consumables, amongst others. In Nasarawa State, the government donated vehicles, other items to the Nigerian army in the state, while reiterating a stance to improve security architecture in the state. The governor revealed the gesture is to facilitate the takeoff of the recently established army camps in Nasarawa and Toto local government areas of the state. And the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development has delivered palliative of 3 trucks of rice, a truck of groundnut oil, to Kogi state government for onward distribution to the vulnerable. The action is said to be in line with the president's order that the palliatives should be distributed to cushion the effects of COVID-19. The Kaduna state government confirmed 5 Almajiri children repatriated from Kano recently tested positive to COVID-19. There are 15 COVID-19 confirmed cases in the state. 6 of them have been discharged, while 9 active cases are being treated at the State Infectious Disease Center. And State Commissioner for Health said the contacts of the new cases are being traced as well. And finally, Benue State, the government converted all the primary healthcare centers in the 23 local councils into quarantine and limited treatment centers for violators of the state's border closure order, particularly those coming from the 6 neighboring states. The governor gave the directive while reviewing the state's restriction order and extending the social distancing use of face mask ban on large gatherings by another 2 weeks to prevent the spread. Let's talk some more on ways to stop the spread of the pandemic. Joining us in the studio is Dr. Shalom Oni. He's a public health physician. Welcome to the program.
Thank you very much, Millicent.
All right. You are a frontline worker. Thank you for all the work you've been doing. But tell us, how is it being on the front line?
Well, as a frontline health worker, it has been very tedious. It's a lot of hard work there. First of all, to create awareness in the community, because when the COVID outbreak started, people thought Nigeria cannot have it. In fact, they felt, it's a white man disease. Oh, the weather is going to protect us. A lot of things. So, as a frontline health worker, we had to battle the issue of creating awareness and letting people know that this disease is actually real, and Nigerians stand a risk, of being affected. So that was there. After that, we started having imported cases, people coming in through flights and land borders, and we started having cases and following cases up. That's what we call contact tracing. We line list people. We get their addresses. We follow them up. We give them thermometers. We ask them to stay indoors. Away from the family members. We check the temperature for 14 days. Some of them to 21 days. It's not been easy. They make phone calls in the morning, in the evening. We take documents. Data we send to the states. We do all that. Now, some of them have not been cooperative. Some of them, we had to use diplomacy. We talk with them, we counsel them. In fact, we even pray for some, just to make sure you show empathy. That is also part of what we've been doing, to be able to navigate the season. Then another thing is we now have places of interest. That is people coming from nations where this outbreak has been ongoing. So that's another kettle of fish on its own. We monitor them, we follow them up. There are instances where people give fake addresses, fake phone numbers. We have to go back and look at the data from the airport and get another accurate information.
These are a few of the challenges.
There are a few of the challenges.
Then, but what about to you, as a health worker, and perhaps to your other colleagues,
Well, there has been issue of PPEs, availability of PPEs, because really, there have not been adequate PPEs to work with at the community level, at the PhD level, even in the general hospitals. So, but then people have been able to come up with innovations. The issue of social distancing. You restructure your office in such a way that you don't have contact with patients. You triage. That's another thing you do. At the entrance of all the hospital facilities, you triage. You ask people questions, even from high index of suspicion. When patients are coming in, you can sense whether this one has an acute illness ongoing. Although there are cases of asymptomatic cases, so you cannot really be sure. But then, this thing are some of the challenges we've been having as far as a frontline worker is concerned.
We definitely know we'll have you again on the program, but we'd like to thank you, for joining us on the program.
Thank you very much.
All the best. Botswana's President Mokgweetsi Masisi has announced a 1-week extension of the nationwide lockdown that was due to end April 30th after 1 month. And he says the extension was agreed after advice from health experts following an increase in local transmissions. The extension will end May 7, followed by 2 weeks of gradual easing. Botswana has confirmed 22 cases of the virus and 1 death. In the meantime, the World Health Organization says the pandemic is far from over, citing concerns about increasing trends in Africa, Eastern Europe, Latin America, and parts of Asia. The Nigeria Center for Disease Control says to remember face masks are to be worn in combination with social distancing, hand washing as well. And the website has all the information that you need. It's also the same with the World Health Organization, rolling updates, strategies, plans on the coronavirus, and each moment it keeps updating. That's our program this afternoon. Thank you for watching. Another update comes your way again at 6 p.m. I'm Millicent Wonka. Stay safe.